you're looking at the life sciences and healthcare industry as a whole. In your own personal opinion, what would you say is probably one of the greatest challenges? And if you're giving an unlimited budget,
Okay.
like a bank account, which basically like a cheat code, you can like press I don't know, press enter and like 10 billion was added or something like that. What would you try to do to address that challenge?
Yes. On a technical level, I would say that the challenge of all these things, I mean, I really love when you say that artificial intelligence is just a tool.
Yeah.
And if we don't have a very specific use case, it's just a buzzword. Yeah, because we have to make something impactful out of that. It's like a knife. You can use it to cut bread or to kill somebody. Very different use cases, yeah?
Or
nothing.
surgery or something.
Or just because it looks very nice on your, next to that poultry we discussed. But the thing is, if I were given, a limited budget, yes, you said it, yeah?
Yeah.
So I would just improve the core issue of healthcare, which is called, it's about access.
Yeah.
And it's about affordability. Yes, because the issue of healthcare for a lot of countries is poverty. I mean, it's no more, no less. I mean, we're talking petabytes in some countries, some privileged countries like ours, but a lot of people still don't even have electricity, yeah? They don't even have hospitals. They don't have access to things, which means that all this reality that we discovered, like precision medicine, whatever, there's no medical data on those populations. They will be excluded by algorithmic level, apart from poverty, from algorithmic level. So this is really something I'm very passionate about. So, in reflecting on that, because a lot of voices these days say that look at healthcare as a cost. And something changed in the last decades because healthcare is to be seen as an investment on the future and because it has an impact on the socioeconomic prospect of a country. And I'll give you an example. Not so long ago, after the Second World War, Europe was in tatters. Japan was destroyed, fully destroyed. It was then that they launched the free universal healthcare services. The NHS was born then, in fact, in 1948. Japan, Norway, a lot of countries that went through the war invested when they were broke in providing free healthcare to people. And this is a reminder for those those people who are saying, no, it has to be seen as a business. It's an investment on the future, like it's an investment of a school. Nobody questions the schools, yeah? Why are we questioning hospitals? Fast forward, things have changed, and Thailand, after the Asian crisis, 2002, decided that they wanted, to offer free universal service, health service, to their citizens. It was an outcry. When the World Bank was against it, everybody was against it. They still went ahead, no matter what. These days, it's like 95% of the population has free access to healthcare. It's been considered as access. The World Bank has apologized formally to Thailand because it's been demonstrated that public healthcare, and again, it's about execution, is more effective and cheaper than privatized healthcare. And if not, just look at the US. It's a very expensive system, not necessarily with the best outcome. So I would make healthcare more accessible, like access to services, and make them affordable as well. There is a way, but everything has to be seen in context.
Yeah, it's actually seen in context, and
but likewise, it's like, and since this is about for startups, for innovators, something that we need to see as well is that when you think about launching something, always think about how can people afford your solution? What can we do? Like health systems need to also look, we're talking about precision medicine, how can we make it affordable? Because the more we will discover, the more we will stratify the more things we will have to bring to the market. So at one point there was going to be some expense that we need to make, yeah?
Yeah.
So, and this is an open question that's going to define our generation. Because we're getting older, but not necessarily healthier. The population is getting bigger. Perfect, storm. And this is the question for you guys, I mean, and girls, like anybody. Okay, we will discover more. We will discover more stratifications of disease, which means that we need to bring more drugs into the market, more things into the market. How can possibly a health system afford all that? How can pharma afford to bring drugs that will have less public, like orphan drugs, things like that, limited populations? But there are some studies that show that in the long run, it will work out. But then also we need to redefine, should healthcare be run as a business or should healthcare be seen as an investment? And that's why there's a lot of debate at the moment as to which are the models. I mean, do we have to have an ROI in primary schools? Exactly. Why do we have to have an ROI to provide care?
Yeah.
I leave it at there. I mean, it's like there's proponents in different ways. To me, what counts is the outcomes. And at the moment, what the outcomes are showing is the privatized systems, out-of-pocket systems provide the outcomes are worse, basically, than in public health systems, yeah? But it's not because less people have access, it's that they actually, privatized systems cost more money in the long run because the incentive is on output. For-profit hospitals, etc. You want more treatments, you want more. So we have also to look into those concepts and see how we bring them. But likewise, from an innovator level, when you make a solution for a specific market with a specific market in mind, always think how that translates into other markets.
Yeah.
Because maybe you don't need so many whistles and things. Maybe you need to adapt it. I was speaking to an entrepreneur from Ghana, and he called us Internet of Dumb Things because he's doing this supply chain, monitoring, but with 2G and SMS.
Oh, interesting.
The payments happen, by text message. We have to think about that. We have to be including solar power.
Yeah.
To go to remote. We have to think the mountain comes to you or we go to the mountain. You have medicalized drones like Zipline that they launched for first time, 6 years ago in Rwanda, in Ghana, and now NASA is catching on. So first Rwanda, 6 years later NASA. Yeah. So let's be creative and look what's happening elsewhere because a lot of the solutions that are going to come from most of the population might not come from your market. So this is a bit. I mean, if I had an unlimited amount of money, I'll provide. I will hospitals or mobile units. I'll make sure the services were affordable, which is not free per se, but affordable. And that will set a baseline because we need that. And we definitely need to digitalize a lot of things because we need to start including data from different populations, countries, groups, so that they are not excluded.
I think it's I think it's really good ambition, and especially because, yes, in order for pharmaceutical business to be viable, they need to be able to make that a profit. But it's really about thinking creatively about how we can both drive that value. Have a system where things are viable financially, but also where we're actually making sure that the very core thing of access and affordability is being met. And it doesn't always have to be a zero-sum game where someone's losing, someone's gaining. I believe there are ways, especially the more so we ideate, to address both of those both sides of the coin and really maximize access and affordability. It's interesting. Your friend you spoke to who used the term internet of dumb things.
I love
it. It could be a case that yes, you're using 2G, yes, you're using SMS technology. But at the end of the day, if they're using that technology, whether it's relatively new or relatively not new, if they're using that technology to solve a large problem, a large unmet need, and drastically improving access to healthcare within those set markets. That's the most important thing. The impact, the outcome.
That's impact, because that's the thing. Technology it's a tool, but technology needs to be adapted to the environment.
Exactly.
I always think it's like people don't think things over. They develop products, for instance, that they will oxidize in a very wet environment.
Yeah.
They don't think about the switches, the electricity, the things. You have to think about these aspects, especially if you go off the beaten track, because at the end of the day, what technology can really help is to improve existing processes. We didn't talk much in detail on the pharma side, but pharma, can improve, the time to market, improve the trials, so at one point the volume of the new drugs that will bring into the market, even though they will not be such a big blockbusters, you will have a lot of mini busters, or blockbusters that will make it up. It's a volume game, So I'm sure they will be okay anyway. But the beauty of technology as well is to provide on the access part is that in some cases, it's not about replacing something existing that's not working so efficiently. That will be it. This online pharmacy applications that we see emerging in a lot of emerging markets is because you have moms and pops pharmacies, but there is a lot of areas where there are no service, so people are ordering, these are the first rails of the digital revolution, for so to speak. But then it's like a lot of people have come to the realization that in a lot of places they will not have hospitals anytime soon.
Yeah.
So that's it. And symptom checkers, things like that. So it's the beauty of the technology where you can reach places that otherwise are not going to be serviced at all. So.
Yeah, exactly. And it's not necessarily a case where we're saying, or people involved in these markets are saying that we don't want hospitals. It's more so a case of if building hospitals is the long-term goal, but it's something which is not immediately, like better was possible, how can we, have a short-term solution in the interim to meet that need whilst we're putting the hospitals in place over time?
Yeah, but also I don't know, like the statistics as well is doctors, there will be millions of doctors retiring in the next 10 years. There's not enough doctors to be replaced or nurses. So we also have an issue of capacity. And even an issue of capacity, if you look at it from a technology perspective, because you need people to run those systems, but you need people to deliver those systems. So we will need to be very, very creative in the next 10 years, because it's a perfect storm, but I also believe that some people are doing things in the right way.
Yeah.
And that's why we need to make sure that we use the technology and apply it in the right way. Drugs, more personalized, but with business models that will be viable for the pharma and life sciences companies involved, but also for the patient and also for the health systems. This can be made possible thanks to technology. We automate, we repurpose the recycling technically, We are doing more with less. And then at the same time, we will activate the patient to be a piece for us to tell us how they are reacting or reacting to pharmacovigilance. The promise is that, we're activating the patient. So if done in the right way, it will be amazing. But as you know, you and I know, execution can kill the cat.
Execution is very, very important. I definitely agree. I think there are some challenges within the space, but I am super optimistic, and I think that some of the advances that we're seeing, some that you touched upon and mentioned in AI, for example, even for example in the space of like preventative medicine, some of the new technologies which is emerging, which are allowing us to potentially detect the risks that people have to certain diseases many years in advance, whether that's from the genomics landscape, whether that's, for example, polygenic risk scores determining which populations have a greater risk to certain diseases so they can live in a way which kind of reduce that risk. Or if you're looking at liquid biopsies, taking like blood samples and doing, for example, multi-cancer blood tests, and effectively with people who are seemingly healthy individuals detecting cancer up to 4 years earlier than usually would have occurred. I think through some of these new technologies which are emerging, I'm optimistic and hopeful that we'll be able to tackle this not just only from the landscape of when people are already sick, but also even from the other side of before they even get to that stage. Can we really start to approach these populations, meet them in this patient pathway, whilst it's a lot easier to address? It should be an exciting future, I would say. Yeah.
We're getting there. I mean, it's about prevention, isn't it?
Exactly.